So I'll talk a little bit about the South Texas Veterans Healthcare System. We do have a couple of different locations here at the Audie L Murphy campus. Also, we have a campus up in Kerrville as well. We do have 6 VA staff clinics. Most of them in the greater San Antonio area. We have the Frank Tejada Outpatient Clinic, the North Central Federal Clinic, the South Bear Outpatient Clinic. We have a clinic out in Victoria, which is about 2.5 hours away. This VA staff. We also have Balcones Heights and Chavano Park. So these are, again, primary care clinics. We also have 7 contract clinics around the city. There's contract clinics for primary care services. So we have the Northeast 410, the Northwest 410, Pecan Valley, and we have one in New Braunfels, Southwest Military, Seguin, and in Beeville as well. Last fiscal year, we provided care to over 96,000 veterans here in the San Antonio area at all of our different locations. That was 1.2 million outpatient visits. The operating budget for our facility is about $755 million. Sounds like a lot of money. It is. About 60% of that pays for our employee salaries. Of course, it pays for all of our contract clinics. It pays for all of our lease spaces. It pays for our pharmaceuticals, everything else. It also pays for a lot of the care we purchase in the community. As we purchase more and more care in the community, we're purchasing it through the Choice Fund. We're also purchasing a lot of it locally. In our healthcare system, we do have over 4,000 employees. We're trying to get up to about a net 4,400 by the end of this fiscal year. So we've made great progress. We're a little over 4,200 at this point in time. Our healthcare system goes all the way out to the service area of our healthcare system goes all the way out to the Del Rio area, and then it goes all the way to the southeast to Victoria, where we have the Victoria Outpatient Clinic. And we're one of several healthcare systems throughout the state of Texas. Our area is a growing area, both for veteran population and also for our number of enrollees. There are a number of uniques. Last fiscal year, of course, the veteran population in the greater San Antonio area was about 252,000 veterans. Of that, about 122,000 are enrolled for VA healthcare. And last fiscal year, as I said, we provided care to about 96,000 veterans, and some form or the other throughout the year. Talk a little bit about the services we provide. Again, at the Audie L Murphy campus here in San Antonio, we have a variety of services: primary care, specialty care, geriatrics, long-term care, palliative care, mental health, surgical care. Here in San Antonio, we do have a spinal cord injury center. We're one of 3 bone marrow transplant facilities in the VA healthcare system, and one of 5 polytrauma rehabilitation centers in the VA healthcare system. And our polytrauma center opened here in San Antonio in about 2011. We are, of course, we're here in Military City, USA, so we do a lot of sharing with DOD. Currently, we have 11 active sharing agreements with both Brooke Army Medical Center and 59th Medical Wing. In many cases, we're using their providers at our facility. Some cases, our providers are going to their facility. In some cases, we're leasing space for them. For instance, we have the new dental clinic at Randolph. So again, we're providing dental services there for veterans at Randolph. And again, we continue to meet with DOD on a quarterly basis to talk about what resources we can share together where we have excess capacity. We also do a lot of academic training at the Audie L Murphy campus specifically. We currently have 157 academic affiliations. Of course, our major affiliate is the University of Texas here, the University of Texas Health at San Antonio. We do have 219 VA paid physician resident slots. That's the 3rd highest in the VA, actually. We do a lot of registered nurses training, both undergraduates, graduates, and military active duty. Also at our facility on a daily basis, you see a lot of Navy corpsmen in uniform. We do participate in the Nursing and Military Affiliations Training Program. We have about 1,250 Navy corpsmen rotate through our facility on an annual basis. We have 15 scrub technicians and 30 behavioral health students. So we do a lot of training. We mentioned space, and space is always our challenge, so we try to look at adding space as much as we can. We have a couple of leases that we hope to award in the next couple of weeks, actually. One is a primary care annex clinic, and actually probably will be here in this area of San Antonio, in the northeast area of San Antonio. Right now, the location is about Nacodoches and 1604. So we will have it's a small lease, it's less than 10,000 square feet, but we'll be adding another clinic there. Probably have 3 primary care providers, so we will be opening up another primary care clinic here in San Antonio. Also, we're adding more and more mental health services, so we are definitely lacking space for mental health providers. So we're actually looking to add a mental health lease specifically in the medical center area of San Antonio. We do have in the works the replacement for our Frank Tejada clinic. We have a major lease done by VA Central Office. And again, we hope that that'll be awarded by the end of September. So again, that will replace the current Frank Tejada clinic we have, along with expanding. It's about 198,000 square feet, I think. And again, it's probably about a 3-year construction period once they award it. And again, we're hoping to award it by the end of September. Some of the things we're working on, again, is improving the veteran experience, increasing access to care, again, using choice and other ways of doing that if necessary to get the care under 30 days. Of course, one of our major clinical priorities is suicide prevention, and we rely a lot on community partners to help with the suicide prevention efforts. So again, that's one of the things we're working on. We're also doing a lot more community collaboration, again, for that very reason, getting our community partners involved in helping provide services, not just to veterans, but also to their family members as well. So again, trying to increase that community collaboration. And again, Texas Serve has been a great partner in doing that as well. The last thing we're working on, we're actually the flagship site for whole health. And again, we have a booth here for whole health. So stop by and learn a little bit about it. But we're in the process of implementing that both this fiscal year, and we're adding some additional resources to it next fiscal year as well. So we're definitely looking forward to that. All right. Other than that, we do have a web page, and I wish I could show it to you, but it's www.southtexas.va.gov. We're also on social media on Facebook, Twitter, and Flickr. So those of you who are on that, please like us and follow us on that. All right. That being said, that was kind of all of my presentation. I actually wanted to just tell you who's here in the room and the resources we have available in the room here. So I'm going to go around the different tables. If I get your table wrong, please let me know. But we started here with the Veterans Benefit Administration. I'm glad to have them here with us. They're a great partner with us. Again, I mentioned the whole health. This is the whole health table. We have Herman Montalva here for the Minority Veterans Program. We have Enrollment and Eligibility. They do a great job on all of our outreach events, enrolling veterans and educating them on their benefits. We have the Women's Health Program, definitely a growing program. Our women's veteran population is growing significantly, so thank you for being here. We have Privacy over here. Nigel Burns is our Privacy Officer. We have our patient advocates here. So again, if you have any issues, our patient advocates are here to help resolve those. In the back, we have Recovery Services. So we're glad to have them here. Care in the Community, right there where Nancy is. We have the National Cemetery Administration. I know they have a table there somewhere. And we have the Transition and Care Management Program is here. We call it OEFOAFOND program. So we're glad to have them here. Also, we have some visitors from the Texas Valley Coastal Bend Healthcare System. They're sitting right here in the front. But if you want to know more about Texas Valley Coastal Bend, they'll be glad to educate you here.